Welcome to Follow the Medical Record, where healthcare experts give insights into the increasing importance of following a patient's medical record through the health ecosystem with compliance, privacy, security, and efficiency front and center. This podcast is brought to you by MRO and hosted by Don Hardwick, Senior Vice President of Client Relations at MRO. Don has been in the health information management industry for over 40 years and has extensive knowledge of how medical records make their way through the healthcare ecosystem. At MRO, Don is responsible for strategic client engagement programs and overall client satisfaction. To hear from all of MRO's industry experts, be sure to visit mrocorp.com for additional content and to sign up for our monthly e-newsletter. Over to you, Don.
Hi, everyone, and welcome to another session of Follow the Medical Record as we talk about clinical forms exchange. I'm your host, Don Hardwick, and thanks for listening today. As always, you can learn more about MRO and myself on our website at mrocorp.com. And please take a moment to connect with me on LinkedIn. I'd love to hear from you. By the way, you can also follow us, or please do follow us actually, on Twitter at MROCORP. I'm excited today to have not just one guest, as I usually do, but two guests on the show today, Lucas Hart and Orlando Broady from MRO. So, Lucas, before we get started here into the topic, would you give our listeners a little bit about your background and your current role at MRO?
Hi, Don. Yes, thanks for having me on the show. So my name is Lucas Hart. I'm the Director of Disability Services here at MRO. I've been in this position for about 2 years now, and I've been with the company going on 7 years. A little bit of background about me. I graduated with a degree in healthcare. When I first started with the company, I began as an account manager and have worked my way up to this position. But that's pretty much about me.
Awesome. Orlando, I'll turn to you and do the same thing. If you would give us a little bit of your background and your current role.
Of course. Thank you, Don. My name is Orlando Broady. I'm currently the Director of Operations for our clinic side here at MRO. And a little bit of background on myself. Grew up in Tennessee and post-college moved to Nashville, where I quickly learned of Metacopy and joined Metacopy about 8.5 years ago, where I started in the distribution center, moved into our release of information, saw an opportunity in our clinical form exchange, and so led that department for a number of years before being promoted to Director of Operations.
Well, both of you have great backgrounds, actually, and been with the company for a while. So congratulations on your tenure there as well. So this program has typically looked at how the medical record plays a part in multiple functions in the healthcare ecosystem, if you will. And one of those items is how it interrelates with the information to support clinical experience with the patient and or financial items with the patient. And one of those things that I am interested in learning a little bit more about, and our listeners to hear, is the clinical forms exchange, as you guys have titled it, and what role those forms play in assisting the patient environment, either from a follow-up healthcare situation or from a financial situation. So, Lucas, I'll start with you and ask, what is the clinical forms exchange? What does that entail?
Yes, so when you're talking about the clinical forms exchange, what that really means is that we offer disability FMLA form completion to the healthcare providers that we partner with. And what that comes down to is our experienced staff that we have on board here will intake those forms and complete them on behalf of the doctor. And now that we've kind of given you, an idea of what that looks like, I'd like to break it down a little bit more and go into like what the workflow looks like to give you a better idea.
If you would walk through that workflow, actually, I'll take it back a little bit further. What stimulates, if you would go back to what stimulates the beginning piece of that a form is needed for a patient?
So when we say, disability FMLA, it could be for any patient that would need those forms completed by their doctor's office. So they're turning those forms into the doctor's office, and that's kind of how we would pick it up from there. And does that kind of answer what you were looking for?
Yeah. Are the forms generally generated via an entity to the patient themselves, and then the patient comes to the doctor's office to be completed?
Great question. We have a few different workflows. For the most part, those are normally tasked to us through the EMR system, and then we'll pull it from there, and then we'll place it in our care portal that we use to document everything. Other than that, the patients can also send their forms directly to us. We're very available to those patients. We give them many different ways to submit those forms because we know how stressful it is just thinking about that paperwork and having to submit it and get it turned in and filled out by your doctor. So we try to eliminate that on the front end as much as possible and just try to give them many different ways to submit it to us. So they can also send it to us via email, or we may have a fax number that they can send that to. Each account that we partner with has a designated account manager. So it's kind of like their, one-stop shop. That patient can reach out to that person for all their needs regarding their paperwork. Does that help kind of explain that a little bit better?
It does. And so from that point, you or your team would get a notice that a form needs to be completed. Then what's your next steps in making sure that form does get completed? And then how is that form then distributed to the requesting party for it?
So once we get that form, we're going to put it into our system. The care portal box.com is the platform that we use. And then the form is invoiced, and it is either billed to the patient or the third party company, or it's billed to the insurance company, whoever is going to pay for that form. And also to mention, we do have some current partners that absorb that fee, but we can discuss that further if needed. But basically, once we get that invoice created and it's sent to who it's billed to, we will complete that form based on when the payment is received. And then the form is completed within 3 business days upon payment. And what we do when we're completing that form is that designated account manager who is assigned to that patient, that facility, is going to remotely access that patient's chart and complete that form based on what is in the system. So we are not making any judgment calls. We're completing everything based on what that provider has stated in that patient's care and in that chart. And then after that, the form is saved, and we'll send it out to the requester or wherever the patient would like us to send it to. Some of them like us to send it directly back to them. Some of them just want us to go ahead and send it to their insurance or to their employer. So it really just takes all of the weight off of the facility and the patient, and puts it on us, and we're able to carry that load for both parties through this process and make it really a streamlined system for both.
So in terms of volume, give our listeners a little bit of an idea of what kind of volume of forms completion y'all see across the country.
On a daily basis, I would probably, we have an average of 40 employees in the department right now, and on average, they're completing 17 to 20 forms a day per person.
Yeah.
That kind of gives you an idea. I mean, we're very busy.
Wow, that seems like a big number actually when you start to multiply it out. If you've got 40 employees doing, 17 requests a day or forms per day, that seems like a lot to me. So that there's Orlando. I guess what's the benefit overall for both the clinics and the patients on the clinics themselves outsourcing this service?
Yeah, to add on a little bit of what Lucas was stating in his earlier question, we complete about 35,000, between 35 and 40,000 forms a year. And that's not to include updates or freebies that we do for some of our organizations. So it really does add up and it continues to grow. But the benefit really is that these forms are initiated most times by the patient. So whether they went to their employer or they went to their private insurance company, and this is typically outside of the normal scope for what our providers or physician practices do. So with us coming on board, they're able to satisfy the patient by taking on these forms, whether it be for FMLA, which is going to help make sure that patient's job is protected or allow the patients to return to work safely. Or if they're off of work, it allows them to be paid while they're off of work. And with this being time sensitive, Metacopy MRO is able to take on these services and get them done in a timely manner versus when the hospital is, sometimes quoting 7 to 10 business days to complete this paperwork, but sometimes they only have 15 calendar days for this paperwork to be submitted to their employer or insurance company. So the real benefit is eliminating phone calls or eliminating upset patients or just eliminating staff having to manage this workload when they could be focusing more on patient care.
Makes complete sense. It seems like, if you're looking at 35, 40,000 of these being performed by your group per year, that volume, certainly dictates that somebody else would have to do that, as you said, that would be taken away from patient care. So completing those forms, certainly an essential part of a benefit for the patients. In disability, is most of that so that the disability would be granted for the patient, or is it subsidizing the records themselves that are sent to disability?
So there's two different scenarios. So for what the clinical forms exchange is, it is so benefits will be granted to the patient. So whenever we're talking about the actual benefit forms or disability forms, as we commonly call them, patients have elected to receive short-term disability or long-term disability or accident claim forms. So with that said, before the insurance companies issue those payments to the patients, they want to make sure that it is legitimate or that the provider can support or has documentation that they're now eligible for that benefit that they signed up for due to them either being seen by the provider or being placed on restrictions or limitations by the provider. So it is typically to issue a benefit to the patient.
So in turning these around, that it seems like that two pieces of this, the content of the document and then just the speed at which you're able to respond back with these forms seems to be both of them seem to be an important part of your process. Have you gotten any feedback directly from patients? Do you ever hear feedback that your service that you're providing is expeditious in helping them get, for instance, paid quick, onto disability and paid quicker?
Oh, absolutely. We've had one of our biggest clinical forms exchange client come on board simply because of our Google reviews. They were looking at outsourcing this service line to someone, and um, they chose us ultimately because they saw where patients spoke highly of our clinical forms exchange and how we helped save their job, or how we helped them get paid while they were not working. So we have definitely heard some praises from patients due to us being able to have a quick turnaround time for this form completion service.
Any other avenues? Is there a need in the hospital setting for forms completion, or is that primarily with the direct patient provider?
I will say that as we move forward post COVID, there are some hospitals that are starting to complete more FMLA or disability paperwork. I will say that clinics see the higher volume of form completion or clinical form exchange, but there still are hospitalists or larger physician practices that are seeing a higher demand for patients requesting them to complete disability paperwork. So I say any physician that has a patient where they've either had to keep them, whether as an inpatient or they have to see them more than that one time, can find themselves being requested or asked to complete paperwork for their patients.
Do you see any difference between the specialties of practitioners, such as orthopedics receive more than, internist or pediatrics, or probably not pediatrics on disability or FMLA, but are there other practices or things that that end up as a higher percentage of forms completion?
So,
Most certainly. Oh, go ahead, Lucas.
all right, I was just gonna jump in. Yeah, so our main practices that we get the most forms for are orthopedic. Another one that comes to mind is OBGYN. Those are probably the two big, larger scale ones that we get a lot of forms for. But I mean, we have a wide range of practices that we partner with across the board. So it's something that is definitely a need throughout each practice for sure.
Yeah, so as Lucas stated, OBGYN and orthopedic are going to be our top specialties, but um, some of our organizations have that mixed specialties, and we can do virtually just about all of those specialties, but specialties such as pain management or psych or behavioral, those tend to see less forms, or like you said, pediatrics, just because with that specialty, it may not require the need for us. So we have all those specialties, but pain management and specialties such as that are a little bit lower volume.
Gotcha. Any other thoughts that you'd like to share on your exchange program with our listeners here?
We've got a system in place that really is able to guarantee, the patients are going to receive their form in a timely manner, without delay. We pride ourselves on giving them the best customer service, so that patient satisfaction and engagement is up, because like I said earlier, we want to make this as stress-free as possible, for these patients. And then on the other side of that, that client side, or physician's office side, one thing that we're really able to offer them is to give them kind of, like I said, take that weight off of their shoulders. We can handle all their communication during the process. All the patients can be directed to us. So we can really take that stress of them having to deal with, those high alert patients that are already frustrated. And, we're more than happy to take them on and, give them the best care and, help them throughout that process. So it's really a win-win for everybody when you really look at, everything on paper. I mean, it's just a great system all around that benefits everybody.
I can certainly see that this is very beneficial to both parties, actually. Relieves the physician's practice from having to do that paperwork. And then in the response time, being able to turn those around quickly is of direct benefit to the patient for both of those types of forms completion. Orlando, you were going to say something else?
Yeah, and I was just going to add that both patients and the facilities or doctors' offices can be confident in their forms being filled out by our staff, because our staff has clinical experience. But also, before we go live with our partnership, we have multiple calls and training sessions to make sure that our staff is completing the forms how the provider would complete them if they were completed internally. So it's important to note that our staff, they're not making their own medical decisions. They are completing these forms based off of what the provider has indicated in the chart, or through special instructions, or what we call a form completion guide that we've received from the provider. So that helps build that confidence that those forms are going to be completed accurately. And I think that's important to know, because that's a very common question that we get when partnering, is how does our staff complete these forms, how they're supposed to be completed.
Lucas and Orlando, it's certainly been a pleasure, talking with you about this. I think that this is a nice fit as the medical record centerpiece, and the benefits that are gleaned for in this case, both the patient and the providers, so that you can tease out of the documentation that's contained in the medical record, accurately complete these forms, and provide a service to both parties, the patient and the provider, all together. So thank you for kind of giving us an overview of what claims form exchange looks like in the industry. And I really appreciate your time on the show today.
Of course, thank you for having us.
Yes, thank you so much.
So for more insights on a patient's medical record, visit the show's page at MROCorp.com, and be sure to explore our additional resources and thought leadership on our website. Please check out our program on healthcarenowradio.com. And finally, be sure to connect with us on Twitter at MRO Corp. Until we talk again, I'm your host, Don Hardwick.